system is the one that protects our bodies from infections that wants to go inside to cause disease, harm, and illness. The immune system has many components to it. We have our bone marrow, our spleen, our liver, our white cells, all of these working all together to protect our bodies from these invaders. What is the difference between bacterial and viral infections? Number one, bacterial infections can go into our bodies and act on its own to destroy our mechanisms. The viruses, they need to go inside our bodies with the help of our own cells, meaning it needs to use our own body's resources in order for it to live and multiply. Another differentiation would be bacterial infections usually lasts more than 7 days. And this is when we feel systemic symptoms. For the viral infections, usually these infections last for less than 7 days because our own immune system starts to create antibodies and destroys them as they start to multiply. Another difference would be in terms of treatment. The treatment for bacterial infections mostly relies on using antibiotics. And for viruses, we have different approaches such as vaccinations and even the use of antivirals. What is the 2019 novel coronavirus, or COVID-19? It is a new respiratory infection that was first identified in Wuhan, Hubei province, China. It was hypothesized to be originating in bats. And in this current situation, it was noted that it can be transferred from animal to person. And now, as the virus grows, it has been proven that it can be transferred from person to person, which is what we're experiencing now with this current pandemic. This is almost similar or has similar characteristics to the viruses in the past named as MERS, MERS, or SARS, SARS. Incubation period for the COVID-19 is usually up to 5 days or even up to 7 days. Frequent symptoms that we encounter with the coronavirus. The most common one is usually fever. It's usually measured as 100.4 degrees Fahrenheit on thermometers, but it also we can consider subjective feeling of fever. It also goes along with respiratory symptoms such as coughing, creation of sputum, and even a sore throat. Other symptoms can also tag along, such as body aches, fatigue, headaches, or even having diarrhea. Fever pattern is not usually understood, but it is very significant to understand as part of the symptomatology. It may be prolonged or even intermittent or on and off. The main transmission of the virus is through droplet transmission. Droplet meaning infected secretions coming from an infected individual. They might transmit this through coughing, hacking, and even sneezing. When the droplets are in the air, they might land directly on our healthy bodies through the eyes, the nasal passages, or even oral mucosa. When we talk about droplet, we have to also consider that these infected secretions can land on surfaces. And when we touch these specific surfaces, we might have the possibility of transferring these viruses when we touch our face, rubbing our eyes, rubbing our nose, and even putting our fingers in our mouth. Approximately 6 feet is what we want to have for distance with these infected individuals to at least assure that we are safe. And we have to consider it also, the longer we get exposed to these infected people, the higher of a chance that we might get the infection. The risk factors. Majority of the time we would hear older patients who are at least more than 65 years old are high risk to get or acquire the infection. This is the reason that in this age group there are higher chronic medical conditions and are usually immunocompromised. Commonly you would find in their specific history that they would have diabetes, heart problems, or even high cholesterol. Another extremes of age would be younger children, less than 1 year old. This is for the fact that they have a lower immune or undeveloped immune system. But we have to consider, as we see the trend of COVID-19, even the younger individuals can get affected. But majority of them usually are asymptomatic, which is even worse for the reason that they can transfer that to the at-risk population without even feeling sick, meaning they are labeled as asymptomatic carriers. Treatment and prevention. As of the moment, there are no current vaccines for COVID-19. And at the same time, experimental treatments are out there, such as hydrochloroquine and azithromycin. Even these specific medications have not been proven to be 100% foolproof cures for COVID-19. The reason why we use it is because there are studies from other countries that it actually help treat patients who are in critical condition. But as of the moment, there has no defined treatment that had undergone full trials and complete studies. But the thing that we need to focus on more is prevention, avoiding exposures to the virus. And how do we do this? Washing our hands often with soap and water, singing happy birthday 2 times would be a good gauge. Avoiding touching our eyes, nose, and mouth with unwashed hands. Avoiding close contact with sick people. And for us who are sick, please stay at home. Cover our mouths when we cough or sneeze with a tissue, and making sure that that tissue is thrown properly into the trash. We need to always disinfect and clean frequently touched objects and surfaces using regular household cleaning sprays or wipes that are alcohol-based. What is the best support? The best support is to boost up our own immune system, which is our natural barrier and protection from not only for COVID-19, but also for any type of infection. Good tips for this would be getting plenty of rest, at least 8 hours of sleep every night. Diet, which is focused more on being on a plant-based diet. When we talk about a plant-based diet, it's more of eating plants, fruits, vegetables, whole grains, nuts, grains, legumes. And another important aspect of this is exercising regularly. With exercise, we boost our own endorphins. We boost our own immunochemicals to fight any type of infection. Ways to naturally support your immune system. Number 1, diet. Being on a plant-based diet has been proven to multiply the capacity of your immune system in relation to its defenses against any infection. Exercise regularly. And for vitamins and minerals, I want to focus on vitamin B's. We're talking about B1, B2, B6, B12, folic acid. All of these, they play an important role in trying to support the immune system in times of illness. Vitamin C's, which is also a potent antioxidant, this can be achieved or retrieved from citrus fruits, vegetables, and even through your supplements. Vitamin D is a fat-soluble vitamin or a hormone, which is cheapest when you get it from the sun. And other minerals that supports our immune system would be magnesium and zinc. Zinc specifically has a good characteristic of fighting viruses. Magnesium, it's just involved in so many enzymatic processes in our bodies that the immune system depends on. And of course, as one of my recommendations would be our immune IVs here in the clinic, wherein we provide all of these specific nutrients in one bag in order for your body to get ample support or even eradicate infections that are inside.